Hello everybody, Bismillah ar-Rahman ar-Rahim. As a continuation of my talk about and presentation about the hypothalamus and the hypothalamic disorders, I just broadcasted today three live streamings episodes talking about the hypothalamus in health and disease and the functions and the causes of hypothalamic dysfunction and the neuropathology of hypothalamic disease and the clinical presentation of hypothalamic disease. And just to finish, we have to know how to diagnose hypothalamic disorders, because as I mentioned, the hypothalamus secretes many hormones, including the dopamine, which is responsible for control of mood and is related to mood and the sensation or feelings of happiness and joy. And also it influences the feelings of reward and motivation. This is the dopamine, and it is secreted, one of the hormones secreted by the hypothalamus. And also number two, the somatostatin, which regulates the gastrointestinal function and has other systemic functions in the body. And then number three, we have also the oxytocin, which is related to the expression of the breast milk and is also related to mood and is sometimes we call it the love hormone, the oxytocin hormone, and it had other effects on body functions other than affecting the breast and the uterus and uterine contractions. And also we have other hormones, the other hormones secreted other than dopamine, somatostatin, and oxytocin are the antidiuretic hormone, which is responsible for the reabsorption of water by the kidneys and help to regulate the fluid balance of the body. Also the corticotropin releasing hormone, of course, which controls corticotropin or ACTH of the pituitary, the thyrotropin releasing hormone, which controls the secretion, the formation and secretion of TSH of the pituitary, and also the gonadotropin releasing hormone, which controls the formation and production and secretion of gonadotropins, that's the LSH and FSH, the LH and FSH. So these are, and also it contains chemical factors which control the secretion of growth hormone by the pituitary, including growth hormone releasing and inhibiting factors, and also chemical factors which control the prolactin secretion by the pituitary gland. So as we see, there are at least 8 hormones elaborated and secreted by the hypothalamus, and through these hormones the hypothalamus affect directly the body organs and the tissues and other endocrine organs, and indirectly through the its effects on the pituitary gland being a part of what we call the hypothalamo-pituitary axis or unit, which, as I mentioned, is the neuroendocrine system of the body. And it represents the link, as I mentioned, between the nervous system and the higher parts of the nervous system, higher levels of the nervous system in the cerebral hemispheres and in the cerebral cortex, and the between the endocrine system of the body, as represented by the major endocrine organs, thyroid, adrenal, and the gonads. So these are the hormones, and accordingly, in order to diagnose, we have number one, important is take a history. That is very important. Just ask about family history, ask about genetic problems in the family, ask about any hereditary disorders in the family. Ask about the symptoms and signs which suggest hormonal imbalance, whether under secretion or overactivity, about symptoms and signs suggestive of secondary adrenal problems. That's features of hypopituitarism as a result of damage of the hypothalamus, whether this is panhypopituitarism or partial hormone deficiency due to partial destruction and partial deficiency of one or more pituitary hormones. resulting in adrenal deficiency or thyroid failure or gonadal failure as a result of hypothalamo-pituitary disease. So accordingly, the clinical features might point to the complications of the hypothalamic disease, because as I mentioned before, among the specific clinical manifestations and the complications are fertility problems, menstrual problems, amenorrhea, also sexual problems, erection problems in males, loss of libido and loss of sexual desire in females, abnormal sexual behaviors in both sexes. So abnormalities in the sexual process, also one of the complications of hypothalamic disease. Abnormalities of the bones, including osteoporosis, and symptoms and signs of metabolic bone disease due to hypothalamic disease or hypothalamo-pituitary disease. Also abnormalities in the heart, abnormalities in the lipid metabolism with cholesterol problems, abnormalities in the blood pressure, because the lowering or elevation of blood pressure, that's hypotension, and the hypertension might sometimes be related to hypothalamic disease. So fluctuations in blood pressure, fluctuations in heart rate are related to the autonomic dysfunction of the hypothalamus, because as I mentioned, part of its function is autonomic control and control of the autonomic system, and including the heart rate, the blood pressure. So one of the manifestations of and complications of hypothalamic disease might be related to blood pressure fluctuations, pulse problems, and also might be related to fluctuations in body temperature due to dysthermia. So we have to assess blood pressure, we have to assess the pulse, we have to assess the temperature. This is the physical examination. We have to look for any signs of endocrine deficiency, hypoadrenalism, hypothyroidism, hypogonadism, as a result of hypothalamic damage or hypothalamo-pituitary disease, because sometimes the hypothalamus is damaged only alone or in conjunction with a pathological process which also destroys the pituitary gland, as it happens in some tumors which damage both the hypothalamus and the pituitary. Because as I mentioned, they are anatomically close to each other. The hypothalamus lies between the thalamus above and the pituitary below, and they are linked together, the thalamus, hypothalamus, and the pituitary. So a disease like neoplasm or tumor or vascular insult might involve one of them or the two together, that is the hypothalamus plus or minus the pituitary gland. So look for adrenal hypofunction, thyroid hypofunction, gonadal hypofunction, growth problems, especially in children with hypothalamic disease. There is affection of growth, there is short stature in many patients. It also affects puberty with delayed puberty or absent puberty. It prevents or delays puberty, as it happens in some hypothalamic syndromes. I mentioned the Prader-Willi syndrome, which present with short stature. I mentioned the Kallmann syndrome, which present with delayed or absent puberty, plus loss of sense of smell in children. So in these syndromes, there will be affection of puberty, there will be affection of stature due to affection of growth. So this is especially important in children with hypothalamic disease. That's pediatric hypothalamic disorders. So we have to look in the physical examination and in the history taking for all of these symptoms and signs which might point to possible hypothalamic damage or hypothalamic disorder. History taking, physical examination, blood tests are very important to analyze look for the blood chemistry, for the electrolytes, for the kidney function tests, liver function tests, and also assess hormones. Very important. We have to look for the levels of the TSH, the thyroid hormones, the adrenal hormones, the ACTH, the cortisol, the also the FSH, LH, estrogen and progesterone levels during the menstrual cycle, at a specific time of the menstrual